We see a lot of patients who've been coming to India from Africa for medical treatment. What do you think is the top few reasons why the patients travel to India, especially for getting their medical treatment done?
Vishal, this has been a long journey of medical tourism between us and the Indian hospitals, where Africans are continuously coming to India for medical treatment. One of the main challenges that is back home is the fact that we lack proper diagnosis. And the reason for proper diagnosis is not because the doctors are not good, but it's because they lack the facilities, they lack the the innovation for easy diagnosis in Africa, especially my country, Cameroon.
Yes, hi. So today I want to welcome Madam Owe Bisong. She is from Cameroon and she is being a medical tourism facilitator. She's been referring people to India for medical treatment. And also now she's here in India as a mother of a patient who is undergoing a treatment in India. He's been doing well and he's been recovering well. And we welcome you on the stage.
Hi, Vishal. Good morning. My name is Obi Egbebison. I come from Cameroon, Central Africa, precisely. I am right here in India for medical tourism and at the same time as a mother with a little boy of 7 years who is suffering from an ailment that required my attention to fly him over to India. So if you are in Cameroon, you're in Central Africa, you're in Africa anywhere, and you have been considering evacuation for treatment, please, I think that India is a good place for you to come for treatment. Do not hesitate, because the opportunities for treatment, the facilities, the infrastructure, the technical, the know-how of the doctors and the people locally is very welcoming for international patients in India. Please don't hesitate. Take it as a try it as an opportunity to get better treatment out of the country. Bonjour, je m'appelle Obi Egbebison. Je sors de Cameroun. Je suis anglophone, mais je parle un peu de français. Je suis à l'Inde ici avec mon fils pour le traitement pour cancer. Mais c'était très bien et je voulais passer le message à tout le monde qui souffre les maladies qui sont très énormes, qui ne peut pas avoir le traitement local, de plus ne perdre pas de temps de venir à l'Inde, parce que l'Inde ici, les docteurs sont très élevés et les hôpitaux sont très bien structurés et ici, le traitement, on vous traite en profond. Donc, n'hésitez pas de venir ici à l'Inde pour le traitement.
So, Madam Ovi, I wanted to check with you, or wanted to ask you about we see a lot of patients who've been coming to India from Africa for medical treatment. What do you think is the top few reasons why the patients travel to India, especially for getting their medical treatment done?
Vishal, this has been a long journey of medical tourism between us and the Indian hospitals, where Africans are continuously coming to India for medical treatment. One of the main challenges that is back home is the fact that we lack proper diagnosis. And the reason for proper diagnosis is not because the doctors are not good, but it's because they lack the facilities, they lack the innovation for easy diagnosis in Africa, especially my country, Cameroon, and the neighboring countries. So we find a situation where we have MRIs, but they are backdated, which requires a lot of intuition in the actually diagnosing what is wrong with a patient. Take, for example, I give you a case like I had a patient who had an issue from birth. The child could not walk after 2 years, and this child was taken for physiotherapy all the time, and it couldn't determine what was wrong with the child. So what happened? The doctor requested that they had to do an operation, and the parents keep asking, why are we doing an operation? For what purpose? Tell us, if you could clearly state why we're doing an operation for this child. Like, he has this, then you can write it down, you can sign it, then we would give you the child to operate. And because the doctor could not actually give a proper diagnosis, so he didn't operate. Now, when they went to do an MRI, the MRI revealed the reason why the child couldn't walk was because he had water in the brain, and that was a big issue. You know, as a parent, telling you your son has water in the brain from an MRI results, that looks like that's out of very, very scary. So they had to contact me, and they decided to move to India. So when they came to India first, the MRI which read water in the brain was not water in the brain. There was nothing like water in the brain. It was the liquid that is the injections that are given before MRI, so they can actually see proper. But because of lack of, let's say, proper technology, the doctor could only read that was water.
Right.
Yeah. So we have so many cases, uncountable, where people have been diagnosed of illnesses that they are not suffering, especially when it comes to cancer. Cancer, it's a big issue for us Africans.
Right.
Before it all came to people doing medical evacuation, when you had cancer, it was a death sentence, total death sentence, because we had no way out of it. There is 80% of the cases, the doctors manage, and the patients end up dying because we don't even have a PET scan to determine how the treatment plan can be intensified, the quantity of the doses. So we have so many challenges as regards to our healthcare system in Africa, and precisely Cameroon, right, that would really warrant you. It's a call for concern that we have to carry out. For me, I look at medical tourism as something of assistance to my people, because if we do not assist them to evacuate, then too many cases they end up dying, or they associate them to other things which are not what it is.
So we have seen in last quite a few years now, the people are coming over for medical treatment. They are getting well. Most of the people get the right treatment and they go back happily. But we have also seen that the lot of difference in terms when we talk about the medical facilities that are available in Eastern African region or Western African region. There's a difference. Mm-hmm. Eastern African, we see a country like Kenya, mm-hmm, where we have a JCI, International Accredited Hospitals. Mm-hmm. But still, we have seen there's a natural flow of patients. If say, talk about Cameroon, they're not going to Kenya they're traveling all the way to India. So is there a kind of a trust on the Indian healthcare system more on the patients, or it is because of the experience and technologies, or a mix of both?
Okay, it's a little bit complicated for Africa.
Okay.
The facilities that are good are overwhelmed with people, and at the same time, they are expensive if they have to give you the actual treatment. And even though we have facilities, those facilities all the time, they cannot be compared with the structure of medical facilities in India. There's a whole lot of variety in India. There are too many hospitals. The technology is different. The personnel are different. The personnel are more trained.
Right.
They are more dedicated to whatever it is they are about to treat or handle. I see that a lot in India. I've been into medical tourism, but I've not spent a lot of time in India. And this is the first time I'm spending so much time. And this time I spent in India, I mean, with you, we had the opportunity to before David was treated, we could have a choice to say, no, I'm not going to Marengo, no, I'm not going to Apollo, I'm not going to Artemis, I'm not going to Fortis, I'm not going to Max, I'm not going to Paras, I'm not going to Asian Hospital. There are so many you can see. Everywhere in India, there are so many hospitals with good structures, and each of them are specialized in their own domains.
Right.
If you're looking for cancer is one of the treatments that brings us to India.
Right.
So if you're looking for cancer hospitals, there are so many options and too many trained doctors.
And all are each as good as another one.
And all are as good as another one.
Right.
They may be slightly something different from this one than to this one, but they are all good. And even in the same hospital, you have the oncology departments with extensive, creative, and absolute great doctors from start to the professors. So for me, there should be medical tourism all the time. When it comes to Africa, they should be, because we haven't gotten to the stage where we can have multiple doctors with all the huge experience. We can have multiple hospitals to choose.
Correct.
Yes. So medical tourism, even in countries like you can name them. You can name a country like Kenya, Nigeria. You can notice that more of the people come from those countries to India.
Right.
Just to tell you that we are still lacking behind in terms of medical tourism. And if medical tourism is taken out, we would not be able to actually survive to get the cases that we are treating right now in India. We would not be able.
Right. So now the medical tourism as a word is something where it eventually came into where the people who require medical treatment, they travel all the way to India. That's one of the destinations.
Okay.
Where we have skilled doctors, we have doctors who are trained abroad, and who came back to India and serving to their people back home. Now, the medical tourism is also considered as a kind of a negative word in terms of the doctors who've been treating the patients locally in Africa. They don't want the patients to travel out. But it's patient's choice that they want to go out for treatment. There could be one of the reasons could be that the lack of infrastructure in terms of diagnosis, where they're looking for a second opinion to travel abroad. But what do you think is few major reasons why a patient is actually going abroad for a treatment? Now, I assume that you're not only working with India, you have worked with Turkey, you have worked with Egypt, you have worked with some other countries also, where you have referred the patients. Now, gaining an experience among these countries and India as one of the destination, what do you think are one of the few of the reason or the major points which you feel that the patients feel comfortable coming over to India than to another country? Because everybody is providing them one of the best of the services for them. But is there any edge you feel that India has than other countries?
India has an edge. First, I would say India has an edge over other countries to my experience. I have evacuated patients to Turkey. I've evacuated patients to South Africa. I've evacuated patients to Egypt. I've evacuated patients to France, to Europe. I've evacuated patients to Tunisia.
Okay.
Now, and those patients are evacuated to Tunisia. Each of them, to these countries, each of them have an experience, and also the team on ground. I also have an experience with the team on ground. Turkey is good in terms of structure, but the doctors do not speak English. There is a barrier of communication between the doctors and the patient's caretaker or family or whatever. It needs to always go through a third-party translated version before it comes to the patient, which is a little bit very complicated and very, sometimes it could be misunderstood in terms of passing the right message of what actually is the issue with the patient. Also, pricing. It's a big issue for medical tourism. You know, with most Africans, they would only think about traveling abroad when they have explored all options.
Right.
All medical options possible locally. If they are not able to get the proper treatment, it's too late. Let's say 85% of the patients that go for medical tourism in Africa, precisely Central Africa, are at the last stage of their disease. And that is when we judge the success rate. Because if you take somebody with a stage 4 cancer to India, and somebody with stage 4 cancer to Turkey, then you know the difference in terms of strength of medicines.
Right.
Yeah. And the two cases I've taken to Turkey, I've taken to India, the difference is sometimes the patients that come to India at stage 4, when it's too bad, they have a longer life expectancy than Turkey. Number one.
Okay.
In India, they would try to manage for you and give you a better life until you can pass away. You can expire.
Yeah.
But in Turkey, the management is totally different. I can say so. I don't know about other people, but the patients I have sent, more of them have passed away in Turkey than in India, if I take the percentage.
Right. So if we talk about you in terms of medical tourism as a business opportunity or trying to help out people to travel abroad, did you plan for this or you accidentally got into this business? I won't call it as a business, but yes, it is one of the services which you're providing.
Yeah.
So is it you accidentally got into it, or was it seeing the opportunity which is going around, you decided to get into?
I didn't just get into medical tourism as a business.
Okay.
First there was a need, and my story is a little bit long, but I'll try to make it short. In 2017, we had a challenging issue where our elder brother fell ill.
Okay.
And I'd been to India before, so I've never been to an Indian hospital, but I knew than India, because when I came here, I saw too many hospitals as compared to other countries.
Right.
So I knew the medical system in India is advanced. I knew that.
Mm-hmm.
So when my brother took ill, and the doctor first gave a diagnosis of aplasia, they gave a diagnosis of, they gave too many diagnoses that were...
Are you talking about the doctor back home?
The doctor back home gave us a diagnosis that he was suffering from aplasia, and he started treatment, and he wanted to do a biopsy, and he said he was going to go through his chest to take the sample. I was like, if he goes through the chest, is he going to make it? I mean, I had so many issues of concern as to his biopsy he was going to do. But nevertheless, we found a way through a friend who was working in for a pharmaceutical company, who referred us to... I explained to him my concerns as to what my brother was suffering, and he then referred us to Venkashawa. Yeah. And in Venkashawa, at that time, I knew exactly what my brother was suffering from, because one of the doctors had told me he had a disease related to leukemia.
Mm-hmm.
And leukemia to me was a death sentence. Nobody ever. I never heard somebody say, I've been cured, or I'm free from leukemia. So to me, that was a death sentence.
Right.
And I asked him, can this be done in India? He said, yes. Yes. And I said, okay. So, to be frank, my family didn't want him to come to India because no one knew about Indian medicines. I was the one that pressed hard for him to come to India. They wanted him to go to America. They wanted him to go somewhere else, any other country apart from India. And I tried to convince the rest of the family by first, what was an advantage is the process of processing the visa was easy for us. It was done online within 72 hours. Within 12 hours, we got the visa.
Great.
So that alone, the facilitation of the visa process was so easy for us that it gave us the edge to come to India than to go to any other country. First, that was the first thing.
So when we say processing the visa, so the patients normally when they travel to India, are they coming on a tourist visa or their specialized visa?
No, they come on a medical visa. So we got a medical visa for him.
Okay.
The hospital sent us an invitation, and we got a medical visa online. And it was a very easy process for him to prepare. And they told us what to do to do. Like the doctors in India can actually advise you to prepare the patient for travel.
Mm-hmm.
So, because he was really somehow weak and he couldn't see. They told us to give him this amount of pints of blood, this amount of platelets, so he can prepare him for the journey.
Yeah.
So once we did that, and he took off to India, so I could see around me, my sister who came to India at that time, we could see there was a need to assist more people suffering from this kind of complicated illnesses, and it was a success story.
So this is how the journey started.
That's how the journey. It was so successful that within 6 months, he was up again on his feet. So that alone was something which we wanted to leverage with the community locally to say, no, why are you suffering from this? And mind you, when we in Africa, we're spending the same amount of money. Every day we go for blood transfusion. We need to, before you get blood transfused at that point in time, We had to rally people to come donate the blood.
The blood.
Yes. So it was impossible for him to survive, because every time you need to rally people to come and it's not like the blood bank in the town where we live is very specialized. It already has the blood there. You just say, okay, I'm paying for so amount of blood. No, you need to go look for people who will be able to donate the blood before they can transfuse him. So it was it's a little bit complicated back there. I think medical tourism, it was a good thing we came into medical tourism.
Looking into, what do you think are the opportunities for Indian hospitals to contribute with an African healthcare system? What are something what we can put into to help just to build up the ecosystem of healthcare facilities in Africa?
It's a very broad question, because contributions to the healthcare system of every country has to be very detailed and concerned with the government itself before we're able to actually say we are Indian can contribute to the healthcare system. But in our own way, as people working, business people looking at medical tourism, just creating simple anchor daycare centers in each of the maybe the cities where patients are flooding from would assist a lot, because the period of management is usually long. So traveling to India is all about money. It's all about spending huge amount of money. Like, you need to be able to pay for your accommodation. You need to earn a living locally here. So, and to stay here for, because most of the patients who come here, they are cancer people with very serious ailments, which they require medical attention, and some of them are very lengthy. So creating like an Encore Day Center is something which would boost and help the people locally.
Right.
It means they will come to India, carry out the major operations, then they are able to go back home. If we can have an on-care center which will manage the treatment together with the Indian hospitals, that would assist the people locally.
So now, as an African, you're planning to travel to India for a medical treatment. What are the major things which you look into? As what are the points which you wanted to consider before you choosing a hospital or a doctor? Because you're living far away, you don't know what exactly is there. So is there any way that you look into what are the things which you want to consider the major points?
First, my advice would be to get a local partner that is already in partnership with a medical facilitating company locally in India. Because when you go that route, you always get it right in terms of the treatment. It avoids too many backslides. I understand that every third person in India right now is doing medical tourism.
Right.
But medical tourism is not just about bringing patients from India, getting them to the hospitals, and maybe trying to fix the medical bills for them for your own purpose.
Right.
To make it expensive for the patient.
Right.
But if you go through established structures, and they will first, when they look into your case, they know the number of hospitals to refer you to in terms of what you're suffering, in terms of your challenge. So once they can refer you to the best, to 3 of the best, which they always have, then that's what you should be looking at. You should be concerned about someone that has a vast knowledge on medical tourism in terms of India, whatever country, even if it is Turkey, even if it is Egypt, you have to consider the fact that you do not know the place.
Right.
So these companies, medical facilitators, are there to support you. They are there to make your life easier. They are there to stand with you, together with you as family.
It becomes like a bridge between a hospital and a patient.
And the patient.
So they connect you both in a way and facilitating you and helping you out.
They become like your family.
Right.
They become like your family. Medical facilitators are a necessary tool in the process of evacuation, because even locally, the challenge for visa is covered, the challenge for ticket is covered, the challenge for journey management is covered, the challenge if you arrive, everything is covered. There are people there to support you. They take you to proper hospitals. So medical tourism facilitation is a big thing.
Being an African lady staying in India for some time for a particular reason why you're here. So how safe or unsafe you feel India is for foreigners who've been coming here for a medical treatment?
India is well, where I am is safe.
Okay.
Where I am is very safe. Where I am, the people are welcoming. Where I am, the hospital is good. First, I want to congratulate the hospital because
thank you.
The doctor did a good job on David. I mean, we have no complaints. You can see it from David. He looks okay. He looks. If they tell you he's sick, he was sick. You wouldn't even have to believe that he was sick. So I feel the hospital the doctors were very, very. They were very, very careful with David as a child.
Right.
Yes, and they provided the right treatment for David, and that I say thank you, God. And I thank my God because I've seen cases that are worse, but my experience, I send patients, as I told you, but I've never been a patient myself.
Right.
So my experience as a patient has given me an insight of like what people go through. I've also met people with bad stories.
Right. So that is what I was coming into, is you being a medical travel facilitator to being a mother of a boy who came for a medical treatment in India. So there's two different journeys. One is you've been referring people to India for treatment. Now you're coming yourself as a patient. So, because how do you feel the difference now?
Yeah, I feel the difference. It's always good to go through a medical a facilitator than walking through the office to the hospital yourself.
Right.
Because every ailment, India has a lot of people.
Yes.
All the hospitals are flooded with too many people.
True.
So if you're coming from Africa to here, you need to be able to have proper attention, and which once you get the right people, you are in the right place, you get the proper attention. You can see we created WhatsApp group.
Right.
Every information was put there. At any time I called the doctor, he was ready to send a message, say, you can administer this drug, you can do this. So that alone, it tells me how important it is. Like, you remember I told you, Visha, I don't know what to use to thank you. Because I don't know how to say thank you, but I will tell you thank you. Because if you didn't give me the right directions, I would not have been able to go through this journey of having a baby. Is a little boy with a very strong illness like David did. So the hospital, the person you are with, it tells everything. I've also met people, Vishal, I've seen people who have been to hospitals and they're not satisfied. And It's true. It depends on how you come. It depends
True.
on the stage which you come to India. But in all, India would give you a proper management.
Do you think, as an international patient coming to India, are you given a priority at the hospital, or still there's a long waiting queue that you have to go through?
No. As international patients, in every hospital, there's no waiting. There's no queue. The international patients are attended to in every hospital, which is good, which is very good. I would say that because there's no waiting list. The doctors are there to receive you at all time. The facilitators are there to accompany you to one hospital to another until you can achieve the treatment that you need. But I feel the pricing, if it's put down a little, it would encourage more people to visit India for medical tourism. I think so, because most of these people, Africans, really don't have money.
Right.
The issue is Africans do not have the ability and possibility to be able to come from. Yes. So most of the funding is done by the family as a whole.
Right.
And some people go as far as selling some properties to be able to have treatment here in India or any country. So India is doing well, but if they go, because medical tourism is a destination for too many countries now.
Right.
Yeah. So if the pricing in India with accompanied by good treatment, not low pricing, bad treatment or lower treatment. Pricing, if the pricing is reduced and the treatment is good, just a little bit, I think it will encourage more.
Do you think it gives an opportunity for doctors or hospitals to go to these countries where you already have the basic infrastructure available, to start doing a program where they do surgical events in your country rather than people coming all the way to India for a medical treatment?
That's a game changer. That's a game changer. It's a game changer because we've run campaigns in 2020.
Yes.
We ran a camp in 2020, and you could see from yourself the amount of people who were sick who came for the campaign.
Right.
And our challenge. What was our challenge? Our challenge was basically the structure.
And it's a relationship between India and Africa, as it's an old relationship between both the continent and the India. So we believe that there is a kind of a trust which is the African people have on the India as a whole, where they feel comfortable of traveling out.
Yes. So as I was saying, if the doctors can fit in, if they can fit in the African structure to do the operations, to do the treatment, it's a very good idea to run a medical camp. So the medical campaign in Africa, where you bring doctors of various specialties, of course not cancer. I mean illnesses that can be diagnosed like replacement of maybe hip replacement, those kind of ailments that it requires one-time operation, not cancer, because cancer
is a long term.
It's a long term, and we don't have the facilities to manage such kind of illnesses in Africa. So if we can, because if we run medical camps with one of operations where the patient requires hospitalization for a few days, that can be done locally, and it's a good opportunity. It's not just about making money, it's also about helping the people. It will be a good opportunity to have an Indian doctor, to have a good Indian specialized doctor back home who carry out operations and treatment on ground.
So, Madam Bisong, this huge issue we see in Africa also, where patients have been suffering from sickle cell disease, leukemia, and they wanted to get a treatment available for them is a bone marrow transplant. So, what is your take into it?
Yeah, this is really a good opportunity for us in Africa, because sickle cell, it's every let me say every 100 persons, the percentage of sickle cell patients is like 5%, I think so, especially in Cameroon. So first, the issue is not being able to have the match. So if we could bring the team locally to run free screening of the donors,
Okay.
then it's a good opportunity for us.
Do you think it's going to help people?
Yes, it's going to help a lot of people, because so many people who are suffering from sickle cells don't even know they are able to get treatment or even get the proper medications for managing the disease.
If you have any queries related to oncology, related to any question related to the medical treatment options, you can always DM us, and for more information we will always get back to you.